Hello. The title of our pilot project is Using AI to Predict Depression, Burden, and Healthcare Utilization in Clinician and AD/ADRD Caregiving Conversations. My name is Nancy Hodgson. I'm Principal Investigator for this pilot project and the Claire M. Fagan Leadership Professor of Nursing at the University of Pennsylvania. For the last 25 years, our team has been developing and scaling evidence-based programs to support diverse populations of dementia caregivers. In this pilot study, our team will be applying machine learning models to audio recorded interactions between clinicians, occupational therapists and nurses, and family caregivers of persons with dementia to see if these models can ambiently predict depression and burden from these interactions. Conversational speech from about 125 one-hour clinical sessions that were tape recorded, de-identified, and then transcribed will be combined with longitudinal clinical assessment data on depression and burden for analysis. We selected caregiver depression and burden as our main outcomes, since these have been identified by the as public health priorities by the World Health Organization because they profoundly affect the status and prognosis of individuals with dementia, often leading to increased healthcare utilization. For our three aims, they are the following. The first is to evaluate the machine learning system ability to identify patterns that signal caregiver depression and burden. Our second aim will evaluate the machine learning system's ability to identify patterns that signal pending healthcare utilization. And for the third aim, we will convene a stakeholder advisory group to help us inform future work on the scaling of our model into a clinical platform. The advisory group will be composed of dementia caregivers and healthcare providers in long-term care, home care, and community-based healthcare systems. The results of our proof of principle study will show whether or not the machine learning model can leverage clinical recording data to improve health outcomes for the over 11 million dementia caregivers in the U.S. by identifying those at risk for clinically important outcomes. These digital markers, we believe, hold promise to improve outcomes for dementia caregivers by allowing for action once a clinical phenomenon is identified. These actions could be in the form of triggered alarms, personalized treatments, or digitally tailored interventions that give advice or guidance on how to handle symptoms like depression or burden. The long-term goal of our research is to develop scalable technology-based platforms that aim to identify and address depression and burden in dementia caregivers. We're grateful to Penn AI Tech, and if you have any questions, my email is listed here. Thank you so much.